Happy birthday, Medi-Cal. You're 50 years young and barely showing any gray hairs. I wish I could make both those claims. Ladies and gentlemen, Medi-Cal represents our commitment to our most vulnerable residents. This is a commitment steeped in honor. We honor human life because we make sure that people are never without proper medical attention. We honor children because we make sure that they are always in a position to have a doctor available. We honor the disabled and the elderly, making sure they get the same high-quality medical care as a candidate for President of the United States. Unlike some who run for president, the enrollees of the San Francisco Health Plan and the Health Plan of San Mateo know better than to brag about a diet filled with hamburgers and French fries. In San Francisco, 1 out of every 6 residents is an enrollee of the Health Plan of San Francisco. In San Mateo, it's 1 out of every 5. Together, that's 250,000 people, a medium-sized city, really, who receive their Medi-Cal coverage through these 2 great organizations. But it didn't start this way. 50 years ago, Medi-Cal covered 6% of all California residents. That's all. Today, it's 33%. I'm proud that today we cover seniors and the disabled, and not just people that are low income. I'm also proud that our 2 great managed health plans offer dental care, eye care, mental health services, and vision care. These managed care plans were the brainchild of San Mateo County and spread throughout the state when local flexibility proved that Medi-Cal could be made better by being managed locally. I want to give a shout out to the women and men of the San Francisco Health Plan and the Health Plan of San Mateo. Each of your plans covers 12,000 seniors and persons with disabilities. You each go the extra mile by serving a population with multiple different languages, everything from Chinese dialects to Spanish to Tagalog to many others. In San Francisco, 28% of the enrollees are children, and in San Mateo County, it's 41%. You know, I'd like to end by sharing a personal story. My late husband served Medi-Cal patients. He was a physician in the emergency room at Chope Hospital. Steve Sierra saw everyone, nearly all of whom were uninsured. Some of the most troubling cases were men and women with substance abuse and chemical dependency problems. One of those patients sent me a letter when he learned that Steve had died. It is so touching and heartfelt that I'd like to read a part of it to you today. Quote, "I was an alcoholic and drug addict in a very dire and desperate way, my addictions having brought me very close to death. It was during these, what appeared hopeless time in my life, that I was blessed enough to be introduced to Dr. Sierra. Even in the dreadful state I was in, I remember Dr. Sierra looking and treating me as a person, a real human being, and not just another addicted, derelict gutter animal. He helped me through some really tough times, the best he could. Sometimes my disease got very angry at him because as I withered in pain from the ravages of heroin withdrawal, I begged for him to give me opiates to kill the excruciating pain. But he knew that wasn't the answer, whereas I had encountered other doctors that would have given me something just to get me out of the way. But Dr. Sierra sat with me on occasion, and I could really feel that he shared the pain. He made me as comfortable as possible without giving in to my addict behavior," unquote. Well, there are a lot of Dr. Steve Sierras who serve Medi-Cal today, and I want to thank you. If not for Medi-Cal, this patient may no longer be alive. Instead, he has been clean and sober for 25 years. While substance abuse and chemical dependency programs existed when Steve was alive, the programs supported by Medi-Cal today are light years ahead of what Steve was able to rely upon as a physician. The point is that we think of Medi-Cal as a benefit to patients. But there's no question that it benefits all medical professionals within the community because it supports the practice of good medicine. It further benefits all of us in society because we can stand tall knowing that health care in our region is guaranteed for everyone. Happy birthday, Medi-Cal. You are 50 years old and still growing. Congratulations to all of you who make Medi-Cal a reality for California, both now and for the decades to come. Thank you for doing an extraordinary job extraordinarily